Hello everyone, welcome to a new session in hematology. Today we are going to discuss about some of the abnormalities you will see in a peripheral blood smear. Okay, and this is a must read topic in hematology. Why? Because this topic is not only important for your theory exams but also for your practical exams. What are the abnormalities we will see in a peripheral smear? See, we will learn lot of disorders, RBC, WBC, platelet. But in order for you to remember things easily, I thought of keeping all those abnormalities that an undergraduate student must learn, must remember in a single video. Fine. So this is important both for your practical as well as for your theory exams. Actually, here I am going to introduce some of the terminologies. And these terminologies again in individual pathologies, that is in individual disorders, we will discuss again. So just my aim of recording this video is that you will have an idea about what these terms actually mean. First, reticulocyte count. Okay, that is the first terminology what we are going to learn. Already I have told you what is this reticulocyte count. Yes, if you want, you can watch erythropoiesis video. I'm going to just stress some important points. Number one, it is stained by supravital dye like brilliant chrysal blue. One more stain, methylene blue. Fine? Yes. Then, I told you for a reticulocyte to become a mature RBC, it will take some 1 to 2 days. And immature reticulocyte fraction, also called as IRF, it is an early sensitive indicator of bone marrow activity and response to iron therapy. Fine? Yes. Once this is done, now let us see about the second important terminology, that is called anisocytosis. That means anisocytosis denotes variation in the size of RBC. Am I right? Yes. And remember, anisocytosis is a feature of megaloblastic anemia and hemolytic anemia, and the red cell distribution width is more than 50. Very, very important. That is significant. I told you that in iron deficiency anemia video, red cell distribution width, it is actually a laboratory parameter which will help us to assess the extent of the degree of anisopoikilocytosis. Am I right? Yes, especially anisocytosis, that is red cell distribution width, also called as RDW. The third important terminology what we are going to learn is poikilocytosis. That means variation in the shape of red cell. We have teardrop cell, oval cell, helmet cell, etc. This is a picture of anisocytosis of red cells. You can see, I told you, when you say that microcyte in a peripheral smear, how will you say that it is microcytic or macrocytic? The size of the RBC has to be always been compared with that of the nucleus of the small lymphocyte. So this is the nucleus of the small lymphocyte. So compared to that, you can see some RBCs are small in size, some other RBCs are large in size. See, some other RBCs are large in size. So some are small and some other large. So this is an anisocytosis. Okay. Then we have what we call it as poikilocytosis. See, poikilocytosis, I told you that what is that? It is the different shape of the RBC. Now we are going to see what are these shapes one by one. Okay. First of all, remember sickle shaped RBC, as the name indicates, it is seen in sickle cell disease. Okay. Yes. So what does this poikilocytosis indicate? It indicates that there is ineffective erythropoiesis and there is hemolysis. So this poikilocytosis is also a feature of hemolytic anemia. Fine. Yes. Next, let us see what are macrocytes and what are microcytes. Macrocytes means, remember, the mean corpuscular volume is more than 100 femtoliter. Microcytes means the mean corpuscular volume is less than 80 femtoliter. Fine? Yes. And remember, microcytes with hypochromia. I told you in iron deficiency anemia, when we say that hypochromia, when the central pallor is more than 1/3. More than 1/3. Okay, we call it as hypochromia, as in case of iron deficiency anemia. Then what are the other differential diagnoses of iron deficiency anemia? Very good. Thalassemia major, minor, thalassemia intermedia. These are the conditions where you will get microcytes. In practical exam, they will ask, okay, tell some conditions of microcytic hypochromic anemia. Then you have to sell this. So in order for you to get in order to get your things properly arranged or in an organized manner, I am making this video so that it will be easy to recollect also when you learn the individual pathologies. Fine? Yes. Macrocytes. Okay, it is usually seen in vitamin B12 and folic acid deficiency. Fine. And remember, these macrocytes in B12 and folic acid deficiency are usually oval in shape, and hence we call them as macroovalocytes. Macroovalocytes are one of the hallmark peripheral smear feature of megaloblastic anemia. I will say that in megaloblastic anemia video later. Then elliptocytosis. Okay, I will show all these pictures. See, in this picture you can see microcytosis. How will you say that it is a microcytosis? You can see very beautiful in this picture. Okay, the central pallor is almost, see, it is more than, see, you can see it, this is the RBC, and the central pallor is more than the 1/3 of the diameter. Am I right? Yes. See, that is very, very important. This is a characteristic feature of iron deficiency anemia. And the RBC, so this is the lymphocyte. You can see the size of RBC is small compared to that of the nucleus of a small lymphocyte. Since I can say that it is a microcytic hypochromic anemia, classically seen in iron deficiency anemia. Fine. Yes. See, these are the poikilocytosis. Poikilocytosis means you can see a different type of cells. Okay, this is the teardrop cells. Okay, you can see what is it? This is the helmet cells. Okay, helmet cells. Okay, all these cells again we will discuss. Don't worry. Then elliptocytosis means it is characterized by the red cells that are elongated. As you can see in this picture. Okay, you can see elongated RBC. Okay, you can see elongated RBC. See, elongated RBC. This is called as elliptocytosis. So elliptocytosis, remember, it is because of the change in the cholesterol distribution in the red cell membrane. Okay, yes, and there will be accumulation of cholesterol, and that is responsible for elongation of RBC. Okay, they will ask you why the red cells are getting elongated, because of accumulation of cholesterol. And remember, elliptocytosis is seen in what we call it as hereditary elliptocytosis. Then we have something called as spherocytosis. Spherocytosis means what? The RBC will be spherical in shape. Normally, what is the shape of RBC? Biconcave. Here, it will be sphere in shape, but that's not the criteria to say that it is a spherocyte. Remember, there won't be any central pallor. You know, normally the RBC has a central pallor. In spherocytes, okay, the central pallor is absent. Here comes then another question. Spherocytosis is seen in, immediately all students will answer, spherocytosis is seen in hereditary spherocytosis, because I told you, elliptocytosis is seen in case of hereditary elliptocytosis. So students will always answer spherocytosis is seen in hereditary spherocytosis. Yes, it's right. It's not, I'm not telling that it's wrong, but remember, spherocytosis is the hallmark feature of, it is a more specific peripheral smear finding of autoimmune hemolytic anemia. That means in spherocytosis, hereditary spherocytosis also, spherocytes will be present. In autoimmune hemolytic anemia also, spherocytes will be present. But which is, in which condition these spherocytes are a more specific finding? Answer is autoimmune hemolytic anemia. In MCQ, if you have two options, they will ask you in which of the following conditions spherocytosis is present. Okay, in that option, if you have to choose one among these, you can go always with the autoimmune hemolytic anemia. Fine? Yes. See, this is macrocytosis. This is macrocytosis. You can see large RBC. Large RBCs. Okay, you can see large RBCs. Okay, this is spherocytosis. See, you can see there is no central pallor. It looks almost like a disc. Am I right? Like a wooden disc. Am I right? There is no central pallor. This is spherocytosis. There is no central pallor. That is very, very important. They are darkly stained. Okay, they are darkly stained. And these are characteristically seen in autoimmune hemolytic anemia, also seen in hereditary spherocytosis. Okay, fine. Then let us see what are target cells. What are target cells? See, target cells means, see, I am going to draw target cell. Look carefully. Yes. So, you will have a central hemoglobin area. Then you will have a region where there is no hemoglobin. Again, you will have a hemoglobin-like area like this. So it looks like a bull's eye appearance or like a target. Am I right? Yes, target. That is why it is called as target cells. Remember, target cells are a hallmark feature of thalassemia major. Why I am stressing this point means in your MCQ they will ask target cells hallmark feature of. Because target cells are found in almost all hemolytic anemia, but it is a hallmark feature of thalassemia major. It is also seen in sickle cell anemia, post-splenectomy and liver disease. Okay, yes, because almost all these cells, they are found in what all conditions, but each cell or each of this what abnormal shape or size or whatever it may be, it is found only, it is specific to only one or two conditions. That only you have to remember. Target cells means immediately the disease which comes to your mind is thalassemia major. Okay, yes, I will show the picture. See, you can see target cells. Am I right? There is a central hemoglobinized area. Normally, there will be a central pallor, but here you have a central hemoglobinized area. Surrounded by that, you have a pallor. Again, you will have a hemoglobin area. So, this is called as target cells. Characteristic, what is the appearance called as bullseye appearance. Characteristically seen in thalassemia, it is also seen in chronic liver disease post-splenectomy. Okay, yes. Next, we have something called as sickle cells. Already you know it is seen in sickle cell disease. We have something called as schistocytes, also called as fragmented RBCs. They are irregular shaped fragmented RBC. They are seen in hemolytic anemia. Most commonly, they are seen in case of DIC, that is disseminated intravascular coagulation. Remember, schistocytes means always we think of some sort of what hemolytic anemias. Okay, yes. You can see here they are fragmented RBC. See, fragmented RBC. Like we will see, like it appears as if it has been detached from the RBC. That is, it is called as fragment RBC. It is also called as helmet-shaped cells. And remember, I told you, no, this is found in all hemolytic anemia. But in which condition these schistocytes are more specific? It is diagnostic. The answer should be MAHA. What is MAHA? Microangiopathic hemolytic anemia. We will discuss what is MAHA, microangiopathic hemolytic anemia. Okay, then we can go for DIC and cardiac hemolytic anemia. All these are the second option, secondary. The first your answer should be helmet shaped cells or schistocytes. Your answer should be MAHA, microangiopathic hemolytic anemia. Okay. What is stomatocytes? Stomatocytes means they are the red cells which have a central slit like central pallor. Okay, you can see here, no, in this picture very beautifully you can see. See, this is an RBC, you can see a central slit. Okay, this is an RBC, you will have a central slit like this. This is the stomatocyte. It is seen in case of hereditary stomatocytosis and severe liver disease. Elliptocytes are seen in hereditary elliptocytosis. Stomatocytes are seen in hereditary stomatocytosis. Spherocytes are seen in autoimmune hemolytic anemia. Then only you have to say hereditary spherocytosis. Fine? Yes. Okay, that's done. Then it is also seen in case of RH null phenotype. This is an extra edge information. If you can't remember, you remember, or else it's up to you. Fine. Next, we have sickle cells. I told you, see, it looks like all these are sickle cells. Okay. Then we have something what we call as acanthocytes. Acanthocytes have spicules. See, there is some a point that you have to remember between two things. One is called acanthocyte and another one is called as Burr cells. See, in acanthocyte, the spicules, that is, you can see, some projections. These projections are irregular projections. Acanthocyte A4A, that is, acanthocyte is mainly seen in A beta lipoproteinemia. A beta lipoproteinemia. The second thing, if you can remember, it is pyruvate kinase deficiency. Okay, yes. We have something called as Burr cells. Burr cells means these projections are uniform in size. Okay, for example, I am drawing two cells like this. If the projections are like this, this is acanthocytes. If it is uniformly spaced, okay, this is Burr cells. This is Burr cells seen in uremia. This is seen in, these are acanthocytes seen in A beta lipoproteinemia. Okay, fine. I hope you understand these things. Yes. Okay. So Burr cells, equal projections. Am I right? Yes, equally spaced. Yeah. Then we have something called as bite cells. See, as you can see, this is Burr cells. See, very beautiful. The projections are equal. Whereas here, irregular projections. Okay. Then we have something what we call it as blister cells. What are blisters? So before going to blister cells, we say what is bite cells. See, in G6PD, glucose 6-phosphate dehydrogenase deficiency. Okay, in G6PD, glucose 6-phosphate dehydrogenase deficiency. Okay, what will happen? The red cells will be consumed in the splenic macrophages, but the splenic macrophages only it won't consume the red blood cells as a whole. It will just like the symbol of apple. Okay, you know the symbol of apple, right? Yes, almost it looks like this. This is the symbol of our Apple iPhone. Am I right? Yes, iPhone. Yes, that it looks as if it just have a bite of the RBC. That is why it is called as what? Bite cells. Okay, this is called as bite cells in G6PD deficiency. Sometimes this bite cells, it will be like yeah, and this bite cells have something what we call as Heinz body. Heinz body is nothing else but methemoglobin. I will say that in G6PD deficiency. Okay, yes. So sometimes this it won't engulf or it won't eat the splenic macrophages won't eat the RBCs complete, but it will at the same time, it will eat partially and it will create some space. So that is what we call it as blister cells. See, I will show the picture. See, this is an RBC, okay, and you can see a gap. See, you can see a gap. This is what we call it as blister cell. What is bite cells? Bite cells means the complete. It has bitten. Okay, you can see in the picture. I will show that. See, this is bite cells. This is bite cells. Okay, bite cells. I hope this is clear. Yes. Next is what we call it as basophilic stippling. Basophilic stippling is nothing else but the red cells will have some blue-black inclusions. Okay, these inclusions are nothing else but ribosomal RNA. They will ask this question in basophilic stippling. What are that blue-black inclusions? They are nothing else but precipitated ribosomal RNA. It is mainly seen in lead poisoning, megaloblastic anemia, thalassemia, sideroblastic anemia, alcoholism, pyrimidine 5 nucleotidase deficiency. But yes, again question, hallmark feature of two important things. One is lead poisoning, number two is megaloblastic anemia. These are the two important points. Okay, lead poisoning is not that much common. You can go for the answer megaloblastic anemia as the first answer. Second answer is lead poisoning. Fine. See, these are the basophilic stippling. You know, within the RBC, you can see dot like the what blue, black, purple inclusions. Okay. Yes. Okay. Then we have something what we call it as Howell-Jolly bodies. What are these Howell-Jolly bodies? They are, see, what is this basophilic stippling? They are ribosomal RNA. Howell-Jolly bodies are nuclear remnants. They are nuclear remnants. They are also seen in case of megaloblastic anemia, but remember, Howell-Jolly bodies are characteristically seen in post-splenectomy. Very important. Howell-Jolly bodies, hallmark feature of post-splenectomy. First answer. Second answer, megaloblastic anemia. See, you can see, in RBC, you can see a single spot. You can see a single spot. So the single spot, that is the nuclear remnant. Whereas that is punctate basophilia or basophilic stippling, it is nothing else but a ribosomal RNA remnants. Okay, yes. What is Cabot ring? Cabot ring means within the RBC, you can see, suppose this is an RBC, you can see a figure of 8 appearance. Okay, so you can see a figure of 8 appearance. This Cabot rings, again, it is nothing else but an artifact. Okay, remember, Cabot rings are the figure of 8 appearance. Some authors are telling that it is also seen in case of megaloblastic anemia, but mostly it is an artifact during a smear preparation because of the lipoprotein damage which is located on the RBC stroma. Then what is rouleau formation? Rouleau formation is nothing else but you can see, this RBC will be stacked, piled upon one on the other. I think rouleau formation you already know. It is one of the stage in erythrocyte sedimentation rate, ESR estimation. Yes. So which all condition you will get rouleau formation? Number one is very important, multiple myeloma. Then Kala Azar. Okay. In all these conditions, there will be hypergamma-globulinemia. See, this has to be differentiated by agglutination of RBCs. Okay. See, in agglutination also we will see this clumping, but in agglutination also we will see this clumping, whereas in rouleau formation also we can see that RBCs are piled one upon another. This is called as coin stack appearance. Am I right? That is, it looks as if one coin is kept over the other. Am I right? Yes. Okay, yes, agglutination of RBC it is seen in case of we have some called agglutinin disease. Okay, that and all we will see later. Okay, in the corresponding videos. So remember, Howell-Jolly bodies, it is also seen in post-splenectomy mainly. Then megaloblastic anemia, Cabot ring, I told you it is probably an artifact. Okay, then agglutination and rouleau formation, Kala Azar, multiple myeloma. That is all the conditions where the gamma globulin is increased. That is hypergamma-globulinemia. It has to be differentiated from agglutination of red blood cells. Okay. Then coming into polychromasia. Polychromasia means the red blood cells, it appears to have like different stains. Okay, it looks like different colors, like a colored RBC. Okay, yes. So it is mainly seen in case of hemolytic anemia, not that much important for you. Post-splenectomy, that is when the spleen has been removed. What is the characteristic finding in peripheral smear? I have already told you, it is the Howell-Jolly bodies. Very important. Yes. See, this is the polychromasia. It's very difficult to appreciate, You can see different RBCs are of different color. It's very difficult to appreciate. Okay, yes. Post splenectomy, remember Howell Jolly bodies. Yes, what is other condition you can see Howell Jolly bodies? Yes, very good. Megaloblastic anemia. What are the other peripheral smear findings in post splenectomy? Just for your MCQ purpose, you can see target cell, you can see fragmented RBC, nucleated RBC, and the Cabot rings. Cabot rings are usually artifact. It is seen in post splenectomy. It is maybe also seen in case of megaloblastic anemia. What is leukoerythroblastic blood picture? As the name indicates, the smear, no, it will look, it has nucleated RBCs, metamyelocytes, myelocyte. That is all the immature, all the precursors of the what the cells will be present. Like, what are the precursors of RBCs? We have the reticulocyte, nucleated RBC, erythroblast, and all. Then we have myelocyte, promyelocyte, metamyelocyte. All this will be seen. It is most commonly seen in case of myeloproliferative neoplasm, bone marrow. Neoplasms, we will have this condition, leukoerythroblastic blood picture. See, this is a leukoerythroblastic blood picture. We'll have immature cells. We have what to say, nucleated RBCs. That is the erythroblast. All will be present. Okay. Yes. See, post splenectomy smear. Okay. See, this is the post splenectomy smear. What are this? Target cell. Target cell means what is the first disease which should come into your mind? Thalassemia. Very good. Okay. Yes. We can see Howell Jolly bodies. Howell Jolly bodies. Okay. Yes. Even basophilic stippling, okay, all those may be seen. But just remember Howell Jolly bodies and target cells, okay, in post splenectomy peripheral smear. So with this I have come to the end of this video. So what all we have discussed? See, actually this video, the main reason I told you, is because it should be everything, that what all the terminologies, what all these abnormalities that you may encounter in reading all the hematological disorders. I have decided to I have just introduced those terminologies. Actually, what is that? Suppose if you are reading your megaloblastic anemia, you are reading Howell Jolly bodies. At that time, no, you should not feel, oh, what is this Howell Jolly bodies? You should not go and take the book and start reading for that. Okay, so just at that time, yeah, Howell Jolly bodies, they are nuclear remnants. Basophilic stippling, they are precipitated ribosomal RNA. Yes, I know already. Basophilic stippling is seen in case of lead poisoning and megaloblastic anemia. So it will be really very easy when you see the hematological disorders. Especially, I have got almost all what I have discussed is RBC abnormalities. Okay, WBCs and all. We will what I will make another video of purely for WBC abnormalities in peripheral smear. Okay, that's as a separate video. But as of now, before what you start reading about the deficiency and hemolytic anemia, I personally felt that a good knowledge about these basic things is very, very important, so that it will be easy for you to approach the topic. Fine, thank you.